Today, we will be learning about routes of drug administration. I know some of you consider pharmacology to be a huge and boring subject. So first, let's understand why we need to study and understand the subject. As dentists, there are cases in which we will need to prescribe drugs, even if they are from a limited range, to treat dental conditions. Also, quite a lot of our patients will be taking some other medications for systemic diseases like diabetes, hypertension, and arthritis. We need to understand the effects of these drugs on the teeth and oral cavity, if they have any, and also, we may need to make a change in our own prescription to avoid interfering with the action of the medicine the patient is taking. Moreover, we need to be familiar with all the drugs used for emergency management, as medical emergencies can happen during dental procedures as well. I hope this made you realize the importance of pharmacology. Without further ado, let's start our discussion on routes of drug administration. Most of the drugs available can be administered by a variety of routes. The choice of route usually depends on the clinical judgment of the physician or dentist. There are a few factors to be considered when choosing the route of administration. Let's see what they are. The physical and chemical properties of the drug, such as its state of matter, whether it is a solid, liquid or gas, its solubility, stability and pH should be considered when selecting the route of administration. The site where we want the drug to act is also an important factor. If there is an oral ulcer, which can be treated by topical application, there is no need to use systemic routes to administer it. We should also keep in mind the rate and extent of absorption of the drug to be given via various routes. Another point to consider is the effect of digestive fluids and first-pass metabolism on the drug. If you're wondering what first-pass metabolism is, don't worry, it will be covered in another video. The time required for action of the drug should also be considered, such as in cases of emergency versus routine treatment. If we need proper control over the dosage of the drug, intravenous and inhalational routes are preferred, as they allow for minute adjustments of the dose. Lastly, the condition of the patient also determines the routes of administration. If the patient is unconscious, good luck trying to give them a tablet to swallow. The routes for drug administration can be broadly divided into those for local action and those for systemic action. Let's look at the local routes. The local routes are used only in those cases where there are localized lesions at accessible sites and for those drugs which have very low or no systemic absorption from the site. Because of this, high concentrations of the drug can be achieved at the site without involving the rest of the body. The other advantage of this route is that there is a very low chance of drug toxicity or systemic side effects. There are three main local routes, namely topical, deeper tissues, and arterial supply. The topical route basically refers to the external application of the drug to the surface of the lesion or tissue for a localized action. It is a convenient and efficient mode of delivering the drug to skin, oropharyngeal or nasal mucosa, eyes, ear canals, anal canal, and vagina. Non-absorbable drugs given orally for action on GI mucosa, such as sucralfate and neomycin, inhalation of drugs for action on bronchi such as salbutamol and fluticasone propionate, and irrigating solutions or jellies like povidone iodine and lidocaine applied to the urethra or other forms of topical medication. In dental practice, antiseptics, astringents, hemostatics are often applied as paints, toothpastes, mouthwashes, gargles, or lozenges. A few deep areas can be approached by using an injection, but the drug should be in such a form that its systemic absorption is slow. Examples of this route are infiltration around a nerve or intrathecal injection. Drugs given are lidocaine, amphotericin B, intra-articular injection in which hydrocortisone acetate is given, and retrobulbar injection in which again hydrocortisone acetate can be given. Talking about the arterial supply route, some examples are intra-arterial injection, which is used for contrast media in angiography. Also, anti-cancer drugs can be infused in femoral or brachial artery to localize the effect for limb malignancies. Let's talk about the systemic routes now. The concept behind this route is that the drug administered through systemic routes is intended to be absorbed into bloodstream and distributed all over, including the site of action, through circulation. Oral ingestion is probably the oldest and most common mode of drug administration. It is safe, very convenient, the patient does not need assistance, it is non-invasive, often painless, and the medicament need not be sterile, and so the cost of the medicine also goes down. Both solid dosage forms, such as powders, tablets, and capsules, and liquid dosage forms, such as elixirs, syrups, emulsions, and mixtures, can be given orally. However, there are certain limitations that oral ingestion has. Can you think of a few? Well, via this route, action is slower and therefore it is not suitable for emergencies. Unpalatable drugs such as chloramphenicol are difficult to administer. The drug may be filled in capsules to work around this. Oral ingestion may cause nausea and vomiting. It cannot be used for an uncooperative, unconscious, or vomiting patient. Certain drugs, for example gentamicin, are not absorbed through the GI tract. Absorption of some drugs is variable and cannot be reliable. Some drugs are destroyed by digestive juices like penicillin G, insulin, or in the liver like glyceryl trinitrate, testosterone, lidocaine by high first-pass metabolism. Let's talk about the sublingual route of administration now. In this route, the tablet containing the drug is placed under the tongue or crushed in the mouth and spread over the buccal mucosa. Please note that only lipid-soluble and non-irritating drugs should be administered by this method. The absorption is relatively rapid. Drug action takes place in minutes. Although it may be slightly inconvenient, the patient can spit out the remaining drug after the desired effect is achieved. The major advantage is that the liver is bypassed and drugs with high first-pass metabolism can be absorbed directly into systemic circulation. Examples of drugs given sublingually are glyceryl trinitrate, buprenorphine, desamino-oxytocin. Another route of administration is the rectal route. Certain drugs, when put into the rectum as suppositories or for enema, get absorbed and produce a systemic effect. This route is particularly utilized for irritant or unpleasant drugs, as well for a patient having recurrent vomiting. For some patients, this mode of administration may be embarrassing. The other drawbacks of this mode are that drug absorption is slower, irregular, and often unpredictable. However, studies have shown that diazepam solution and paracetamol suppository are dependably absorbed from the rectum in children. Drugs absorbed into external hemorrhoidal veins, about 50% of the total drug volume, bypasses the liver, but the volume of drug absorbed into internal hemorrhoidal veins does not bypass the liver. Rectal inflammation can happen because of irritant drugs. Indomethacin, diazepam, and ergotamine are examples of drugs given rectally. Let's discuss the cutaneous route now. Highly lipid-soluble drugs can be applied over the skin for slow and prolonged absorption. In this route also, the liver is bypassed. The drug can be incorporated in an ointment and applied over a specified area of skin. An interesting method of drug delivery is transdermal therapeutic systems. These are devices in the form of adhesive patches of various shapes and sizes, around 5 to 20 cm square, which deliver the contained drug at a constant rate into the systemic circulation via the stratum corneum. The drug, in solution or bound to a polymer, is held in a reservoir between an occlusive backing film and a rate-controlling micropore membrane, the undersurface of which is smeared with an adhesive, which also has a coating with the priming dose of the drug, that is protected by another film to be peeled off just before application. The drug is delivered at the skin surface by diffusion for percutaneous absorption into circulation. The micropore membrane is designed such that rate of drug delivery to the skin surface is less than the slowest rate of absorption from skin. This offsets any variation in the rate of absorption according to properties of different sites. So basically, the drug is delivered at a constant and predictable rate irrespective of the site of application, which is usually on the chest, abdomen, upper arm, lower back, buttocks, or mastoid region. Transdermal patches of glyceryl trinitrate, fentanyl, nicotine, and estradiol are available in India, while those of isosorbide dinitrate, hyoscine, and clonidine are available in the global market. These patches are generally designed to last for 1 to 3 days. Coming to the inhalational route, volatile liquids and gases are given by inhalation for systemic action. For example, general anesthesia. Absorption takes place from the vast surface of alveoli. This means that the action of the drug is very rapid. When administration is discontinued, the drug diffuses back and is quickly eliminated via expired air. So, controlled administration of the drug is possible with moment-to-moment adjustment. The mucous membrane of the nose can also readily absorb many drugs. Digestive juices and the liver are bypassed. However, only certain drugs like GnRH agonists and desmopressin used in the form of a spray or nebulized solution are given through this route. Okay, now we are going to discuss the parenteral routes of drug administration. Traditionally, the parenteral route refers to drug administration by injection, which takes the drug directly into the tissue fluid or blood without having to cross the mucosal membranes inside the body. The limitations of oral administration are avoided. Drug action is faster and surer. This is of critical importance in emergencies. gastric irritation and vomiting are not provoked. The parenteral route can even be used in unconscious, uncooperative, or vomiting patients. There are no chances of interference in absorption of the drug by food or digestive juices. The liver is bypassed as well. All these advantages, but what about the drawbacks of this mode? Disadvantages of parenteral routes are: the preparation has to be sterilized and is costlier. The technique is invasive and painful. Assistance of another person is generally required, although self-injection is possible. For example, insulin by diabetics. There are chances of local tissue injury, and in general, if the person administering the injection is not trained properly, it is riskier than the oral route. The parenteral routes we'll discuss are the subcutaneous route, the intramuscular route, and the intravenous route. In the subcutaneous route, the drug is deposited in the loose subcutaneous tissue, which is richly supplied by nerves. Because of this, irritant drugs cannot be injected. However, the subcutaneous tissue is less vascular, which means that absorption of the drug will be slow. Self-injection is possible because deep penetration is not needed. This route should be avoided in shock patients who have vasoconstriction, as the absorption will be delayed further. Repository preparations, which are oily solutions or aqueous suspensions, can be injected for prolonged action. A few notable ways of drug administration using this route are dermojet, pellet implantation, and sialistic, which is non-biodegradable, and biodegradable implants. Dermojet has been used for mass inoculations. Pellet implantation is a good way of administering testosterone, and sialistic implants have been used for hormones and contraceptives. In the intramuscular route, the drug is injected in one of the large skeletal muscles, most commonly the deltoid, triceps, gluteus maximus, and rectus femoris. Since the muscles are not as well innervated with sensory nerves as compared to the subcutaneous tissue, it is possible to inject mild irritants into the muscle. Moreover, since muscles have a rich vascular supply, the absorption of the drug is fast. This route should be avoided in patients who are taking anticoagulant medications. In the intravenous route, the drug is injected as a bolus or infused slowly over hours in one of the superficial veins. The drug reaches directly into the bloodstream and its effects are produced immediately. The intima of veins is insensitive and the drug gets diluted with blood. Therefore, even highly irritant drugs can be injected intravenously. But the drawbacks of this route are that thrombophlebitis of the injected vein can occur and necrosis of adjoining tissues if extravasation occurs. These complications can be minimized by diluting the drug or injecting it into a running IV line. Also, only aqueous solutions can be injected intravenously. The dose of the drug required is the smallest because bioavailability is 100% and even large volumes can be infused. One big advantage with this route is, in case response is accurately measurable, for example in blood pressure, and the drug is short-acting, for example sodium nitroprusside, titration of the dose with the response is possible. However, this is the riskiest route because vital organs like the heart get exposed to high concentrations of the drug. Possibility of causing air embolism is another risk. Alright, that's it for the video. Let's do a quick recap. The routes for drug administration can be broadly divided into those for local action and those for systemic action. There are three main local routes, namely topical, deeper tissues, and arterial supply. The topical route basically refers to the external application of the drug to the surface of the lesion or tissue for a localized action. It is a convenient and efficient mode of delivering the drug to skin, oropharyngeal or nasal mucosa, eyes, ear canals, anal canal, vagina, etc. Oral ingestion is probably the oldest and most common mode of drug administration. It is safe, very convenient. The patient does not need assistance, it is non-invasive, often painless, and the medicament needs not be sterile, and so the cost of the medicine also goes down. In the sublingual route of administration, the tablet containing the drug is placed under the tongue, or crushed in the mouth and spread over the buccal mucosa. Only lipid-soluble and non-irritating drugs should be administered by this method. Examples of drugs given sublingually are glyceryl trinitrate, buprenorphine, desamino-oxytocin. Certain drugs, when put into the rectum as suppositories or for enema, get absorbed and produce a systemic effect. This route is particularly utilized for irritant or unpleasant drugs. as well as for patients having recurring vomiting. Highly lipid-soluble drugs can be applied over the skin for slow and prolonged absorption. In this route also, the liver is bypassed. The drug can be incorporated in an ointment and applied over a specified area of skin. Volatile liquids and gases are given by inhalation for systemic action, for example, general anesthetics. Absorption takes place from the vast surface of alveoli. This means that the action of the drug is very rapid. The parenteral route refers to drug administration by injection, which takes the drug directly into the tissue fluid or blood without having to cross the mucosal membranes inside the body. The limitations of oral administration are avoided. The types of this mode are the subcutaneous route, the intramuscular route, and the intravenous route.